Neisseria and Moraxella catarrhalis. For an introduction, we have Neisseria gonorrhea, which causes gonorrhea. It's nice when it's in the name, makes it easy. And then you have Neisseria meningitis, which can cause fatal bacterial meningitis and sepsis. Once again, in the name, so kind of nice, right? Then you have Moraxella catarrhalis, which typically can cause otitis media, which is your middle ear infection, and it can also cause respiratory tract infections. Neisseria are aerobic, gram-negative diplococci. They will actually have a flattened adjacent side. So the Diplococcus, there's the two flattened sides lying together singly, and they appear to look like a kidney bean shape. Neisseria are oxidase positive. They are fastidious. So remember, if we think about your different types of organisms and nutrients, they are picky eaters. So they like a little additional nutrients to grow. They're also capnophilic. So they require a 5 to 10% carbon dioxide environment. So if you have a CO2 incubator, your plates for growing Neisseria will go in there. With Neisseria gonorrhea, we always want to avoid extreme temperatures and drying. Again, as I mentioned in the specimen collection chapter, if you get a swab for a Neisseria gonorrhea culture, you do not want to refrigerate that swab. It will die. Typically, Neisseria gonorrhea is going to be seen on direct smears within the white blood cell, as well as extracellular, so finding a gram-negative Diplococcus intracellularly from a urethral specimen or a vaginal tract specimen is typically going to be diagnostic of a patient with gonorrhea. And Neisseria gonorrhea is always pathogenic. It can be recovered from anogenital as well as oropharyngeal. It also may be transmitted from mom to baby, so therefore it can cause an eye infection in the baby during birth. Specimens could be from the urethra from men and cervical from women. However, you also can be asked to, set up blood, joint fluid, and eye swabs, which would be collected on a dacron or rayon swab with a plastic shaft. And if you have to transport this specimen and you can't set it up right away, there is a special plate called a Jimbeck transport system, and it's like a little rectangular plate that you will directly swab onto. There's a little disc that will help create a CO2 environment. So you put the lid on the plate and it goes in the Ziploc bag until you can actually plate it up. Neisseria gonorrhea's clinical significance in men is that it can cause acute urethritis, mild pharyngitis, anorectal diseases, as well as conjunctivitis. In women, it can cause cervicitis, pharyngitis, anorectal, and it can also cause pelvic inflammatory disease. And if Neisseria gonorrhea can disseminate, and if it does disseminate through other parts of the body, we can recover it from the joint fluid. So septic arthritis, dermatitis, endocarditis, and meningitis can occur, and it can cross the blood-brain barrier. So for cultural characteristics and identification, again, it grows best at body temp, so about 35 to 37 degrees Celsius in the incubator. Again, it's capnophilic or carbon-loving organism, so that CO2 needs to be increased. So you don't want to put it in your room air incubator. It needs to go into a CO2 one. It is fastidious, so it needs a little more nutrients to get it to grow. So typically we will plate it onto a chocolate agar. And there are selective augers specifically for the recovery of Neisseria, and those include modified Thayer-Martin, Martin-Lewis, and New York City agar. Most of those media will contain antibiotics, which will help to inhibit the growth of other gram-positive organisms and other gram-negative organisms, and yeast and fungi. When we do get growth in the plates, we typically will see a shiny gray, pearly-looking colony, and we'll also do an oxidase test. And the oxidase test will detect the enzyme cytochrome oxidase, which all Neisseria species have, so your oxidase will be positive. Within the species, we're going to set what we call a CTA, or a cysteine tryptic agar, or rapid fermentation sugar test, so you can differentiate the species based on the acid production of glucose, maltose, lactose, and sucrose. So you always want to make sure you keep it in that order, and we'll explain that later. But usually it's going to be a pale pink agar, and you're going to do a heavy inoculum, and then you are going to re-incubate those, and we'll be looking for a yellow color. So we're looking for the acid production to shift that pH. So you can see in the pictures there, the CTA test and what it would look like for each one of those. You can also do a rapid nucleic acid probe, which either will ID from plates or better yet, directly from the specimen. So you don't have to wait for that growth time to delay results even more. The methodologies used to try to get your Neisseria ID'd would be your enzyme immunoassay, your enzyme linked immunoabsorbent assay or ELISA, and DNA probes. Neisseria meningitis patients may be asymptomatic, so they may be in a carrier state, or it can be a life-threatening disease like meningitis. It's a gram-negative diplococcus seen as either extracellular or intracellular, particularly that is seen in the cerebral spinal fluid. Neisseria meningitis can be normal inhabitant of the oral pharynx or nasopharynx. So if you recover this from a throat culture or a sputum culture, unless it's predominating, in the culture, which typically will move that into the normal flora category. And the transmission of meningitis is by inhalation of airborne droplets or direct contact with respiratory secretions. Collection and transport for Neisseria meningitis. So types of clinical specimens. So specimens commonly collected for these diagnoses include cerebral spinal fluid or CSF, which is kind of the gold standard for meningitis diagnosis, blood for detecting bacteremia or sepsis, joint fluid, so synovial fluid in cases of septic arthritis, pleural fluid when emphysema or pleural infection are suspected, or even a biopsy specimen from infected tissues if applicable. For handling and transport, immediate transport to the laboratory is critical to preserve viability. We can avoid exposure to cold temperatures and drying, so Neisseria meningitis is fastidious and sensitive to environmental stresses. Specimens should be kept at room temperature or not refrigerated. We should use sealed, sterile containers to prevent drying them out. So the importance of proper specimen handling is delays or improper conditions can result in loss of bacterial viability and false negative cultures. Ensuring specimen integrity maximizes diagnostic yield and guides prompt treatment for our patients. Neisseria meningitis might cause meningococcal meningitis. So by definition, this is the inflammation of the meninges that is caused by Neisseria meningitis infection. Clinical features, they'll have a sudden onset of fever, headache, and neck stiffness. They may have photophobia or altered mental status and nausea or vomiting, and it may progress rapidly to coma and death if it is left untreated. For diagnosis, we will do a cerebral spinal fluid analysis with gram stain showing gram-negative diplococci. Culture and PCR will help to confirm this diagnosis. For meningococcemia, so this is disseminated bloodstream infection that is caused by Neisseria meningitis. This is characterized by a high fever, chills, and malaise. They'll have a rapidly progressive rash, so they'll have petechiae that'll go to in purpura, and then we'll have hypotension and shock. Complications, they can have bleeding and coagulation abnormalities, which could lead to disseminated intravascular coagulation, or DIC, and can lead to widespread hemorrhage and organ failure. Multi-organ failure and death without prompt treatment can occur. So if we get a body fluid to set up, you're going to have a protocol for like your setup with cerebral spinal fluid, and part of that protocol is going to be recovery of Neisseria meningitis as a causative agent. So we will centrifuge our body fluid specimens to try to concentrate the number of organisms, and we try to make sure we do not contaminate the sediment, as we will need to use some for a gram stain and some for the culture. So if your gram stain slides are not sterile, which they usually aren't, we're actually going to dip in for the culture first and then dip in the specimen for the slide for the gram stain. Neisseria meningitis does grow on blood agar, however, it still does like chocolate agar. Then we incubate the same as the other Neisseria, and usually with Neisseria meningitis, we get more of a round, moist, slightly kind of tan looking colony growth. You can do a direct antigen detection with the latex agglutination. And at one time, penicillin was the drug of choice for treatment. However, if patients are allergic to penicillin, chloramphenicol can be used to treat. Now we have other Neisseria species, but typically they're not considered pathogenic or recovered. So we're going to go ahead and transition to Moraxella, and then we'll come back to the rapid fermentation test that we talked about earlier. So Moraxella may be normal flora of the nasal pharynx or the upper respiratory tract. Specimen collection and transport, usually what you're going to get is a lower respiratory tract specimen because that's usually where the suspected infection is. And so in that case, you're going to probably get a sputum. Moraxella catarrhalis can cause bronchitis and bronchial pneumonia. And in adults, it can also cause acute sinusitis, and it can cause otitis media in children. Infections in the immunocompromised and elderly patients with pulmonary diseases, such as well as conjunctival infections in children. Moraxella catarrhalis grows on 5% sheep blood and chocolate agar. So again, your only other Neisseria that grows on the line is meningitis. In this instance with Moraxella, your colonies will be a grayish white or creamy pink, and they'll kind of have a drier look to them. You're able to push them around across the media, so some textbooks may call it like a hockey puck colony. Moraxella catarrhalis does not produce acid from the carbohydrates, so all the CTA sugars are negative. Most strains do produce beta-lactamase, so we always need to report the organism as beta-lactamase positive or negative.